What's up, everybody? I'm just pinning this comment really quickly. Give me a second, and we will get started. Today, we're covering. I'm going to be debunking myths about PrEP and PEP. Hello, Millennium. How are you? To make an appointment. Pin the comment. Yeah, so today I'm gonna be discussing debunking myths about PrEP and PEP. You know, of course, there's always myths about new drugs, and especially when people, because actually PrEP and PEP is not, at this point, isn't new. It is something that's been around, but you know, some people don't really know, or we're not 100% educated about it. So we just decided to do a small live on debunking myths that are associated with the medication. Okay, Whitman-Walker is here. Start once you get Whitman. Okay. Hi everybody, my name is Corey. I use him, his pronouns. During the past few months, Whitman-Walker Community Health Department has expanded its outreach efforts to social media platforms. We cover various topics about HIV and STI sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to support you. Today I'll be debunking myths about PrEP and PEP. The first myth number one, HIV PrEP is only for gay males. Regardless of your sex or sexual orientation, PrEP may be an option if you're HIV negative, but have an increased risk of contracting HIV. Consider talking to your doctor, of course, about PrEP. If you are in a sexual relationship with an HIV positive person, do not regularly use condoms while engaging in sex with partners whose HIV status is unknown, who are also at high risk of contracting HIV. If you're an injection drug or needle sharer. Myth number two, people only need to take the PrEP pill before they're exposed to HIV. That's not true, of course. PrEP should be taken every day, every single day on a regimen. PrEP can reduce the risk of contracting HIV through sex by over 90%, and the risk of contracting HIV by injection drugs by over 70%. But these numbers decline when it's not taken as directed. It also takes time to build up in your system. Full protection from PrEP isn't achieved until after 7 to 20 days of daily use. So it's very, very important for you to make sure that you're taking PrEP on a regular basis daily. If you skip a day, that's okay. Get back on it. If you are taking PrEP, but it's something that you need to consistently take for it to be effective as possible. Number four, the PrEP pill is too expensive. PrEP is not a cheap medication, but in many cases it can be made affordable. Most health insurance plans cover PrEP. If you don't have health insurance or you have a low annual income, you may be eligible for medication assistance programs, which provides PrEP at a little to no cost. For instance, Whitman-Walker has a PrEP and PEP clinic. If you can't get to Whitman-Walker, you can also go, if you have been exposed to HIV within 72 hours, you can also go to a local hospital and have a PrEP regimen. This is not just for just random cases. This is definitely something that is for an emergency use. If you are having high-risk activity, you definitely should just consider getting on PrEP as a precautionary measure. Number five, PrEP has several side effects. Most people tolerate PrEP quite well. Minor side effects include nausea, dizziness, headaches, and fatigue, but they often go away over time. Rarely more side effects including problems with your kidney, liver, or bones can happen, but that's something again that's very rare. That's not something that happens on a normal basis. It is something that's rare. Once you start on PrEP, you should see a doctor every 3 months to repeat HIV tests and follow up to be sure to let your doctor know if you are experiencing any issues with the medication. Of course, if you're taking any type of medication, you want to make sure that you're being transparent and talk to your medical providers. If anything is, if you're feeling something wrong with your bones, liver, kidneys, if you have persistent symptoms from the medication, you want to make sure that you are telling your doctor about the stuff because they could change. Because there are multiple types of PrEP. There's Descovy and there's Truvada. One of them might work better with your body than the other. Number 6, PrEP can make someone resistant to HIV medication if they do become infected with HIV. People have questioned whether taking PrEP can cause the virus to mutate and become resistant to medications that treat it. Studies have shown that this occurs in only a very low percentage of cases. In most situations, resistance develops because the individual is unknowingly HIV positive at the time that PrEP is initiated, as PrEP doesn't work for people who are HIV positive. The individual is now taking PrEP daily as directed and becomes HIV positive while taking the medication. To prevent this, regular HIV screenings before and during PrEP treatment, along with consistently taking the medication, are essential. For the small number of individuals who develop a resistance to Truvada, other anti-HIV medications may still be available to treat HIV infections. So myth number 7. PrEP can be used in emergencies after potential exposure to HIV has already occurred. So again, this is what I was talking about earlier. You definitely, with PrEP, you want to make sure that you are taking it on a consistent basis. So although they are both are used for HIV prevention, PrEP is not the same as PEP. Post-exposure prophylaxis, PrEP is started before exposure to HIV. PEP is, again, it is something that is taken after exposure within 72 hours. A 72-hour window possible that when you're exposed to HIV. PEP involves the use of HIV medications once or twice a day it's a 28-day regimen to prevent HIV infection from developing. When it comes to HIV prevention, PrEP can be a great tool, but persistent misconception may make people hesitant to try it. Ask your doctor, of course, if you would like more information about HIV. PrEP always increase your knowledge. Knowledge is power. Again, Whitman-Walker Health has a PrEP and PEP clinic. It is very, very easy. You complete your lab work. They will conduct your lab work, including HIV and STI testing in the PrEP lab or the PrEP and PEP clinic. You get your PrEP medication. If you wish to obtain your medication from a Whitman-Walker Health Pharmacy, you can skip the usual line. Our team will have your prescription ready and waiting for you at the appointment. You can receive your next appointment. After your original appointment, you receive your next appointment. PrEP clinic staff call you to schedule. Of course, you'll follow appointments every 3 months. And that's basically it. It's very, very simple. So if anybody's interested in a PrEP to speak with a PrEP specialist, you can contact our PrEP clinic team at 202-939-7690 or email prepclinic@whitman-walker.org. That's about it for today. Before we go, of course, I got to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. Variants, of course, still are soaring across the United States at the moment. It's totally understandable why you would want to keep wearing your mask. The vaccine is not 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Keep staying alert, of course. It's very, very important. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccines available. Everyone 5 and up are eligible to receive the COVID-19 vaccine, please reach out at 202-207-2480 to make an appointment. If you're having problems making an appointment there, for DC residents, you can find information on COVID-19 vaccine walk-ups, locations, and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. And you can track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait. If you're a Maryland resident, the vaccination distribution process and schedule vaccination an appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, you can visit their vaccination portal here. If you live in Montgomery County, visit their vaccination portal or call 240-777-0311 to schedule an appointment. For Virginia residents, you can learn more about their Virginia vaccination process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please make sure that you continue to follow CDC's guideline for mask wearing, social distancing, and the like. It is very important that you consider the vaccine and make sure that you're discussing precautionary measures with those around you. Be mindful of masks. Keep your distance, especially when you are not sure if a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and checking our website at whitman-walker.org for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, call us at 202-797-4439. Follow some of our programs and Whitman-Walker family at Real Talk DC _ and at No Filter DC.